Good morning, Craig.
Good morning, Greg. Thanks for inviting me, and thank you very much to WLSA for the opportunity to speak with you today and at this conference.
Well, thanks for making some time for us. And I was mentioning to you, you probably earned the long-distance travel to get here, hailing from Cape Town.
Well, hopefully, it's the first of many trips and a long relationship that we're looking to establish with WLSA and its members.
Excellent. So let's talk a little bit about that. You were on a panel on the sustainable healthcare system yesterday. What'd you talk about?
So we spoke about rising costs and the unsustainable nature of healthcare. Looking at technologies as well, we realized that those push costs even further up. So looking at very disruptive ways of using mobile technologies across the value chain to be able to reduce those costs. We at the GSMA believe that the members, being mobile operators and mobile ecosystem partners, have a very significant role to play in that. And we look to establish partnerships where those mobile operators can leverage their voice, text, data, and all of their network assets into partnerships, very robust partnerships, that we can push across networks and achieve the scale that we can't necessarily achieve in healthcare, and in so doing push down costs, keeping people out of hospital and keeping people satisfied and engaged in their own healthcare.
So this is not a phenomenon unique to South Africa. I would assume this is a global push?
Absolutely. We track in the region of about 1,800 services globally. So we know that there's a phenomenal growth in M-Health across the world. We know that the US is leading on a lot of product innovation. We know that other regions like Africa are leading on a lot of the business model innovation. Europe is leading on a lot of the regulation and policy standards formulation. And then Asia is an entirely different market, looking at an entire value chain of partners coming together at a scale which is really unprecedented anywhere around the world.
So you're based in Cape Town. I imagine you spend a fair amount of time on the airplane.
We do. So we're headquartered in London, and with regional offices. We have a fantastic office in Nairobi, Kenya. But a lot of our work focuses on really building out the opportunity of M-Health in the emerging markets. So very big focus is obviously India, Indonesia, Nigeria, the east coast of Africa. And really the reason for us being here is to try and catalyze partnerships along the continuum of work that we've established in those markets with the WLSA membership.
So as a physician, how did you get involved, and what's your tenure over there?
So as with all physicians, I think stumbled out of medicine and into the world of technologies. And we started working with the United Nations on a program that they were launching at that time in Southern Africa, and then met with a number of GSMA employees who were at that time launching their strategy on M-Health. And it was a fantastic initiative, and as you can imagine, having a reach or potential reach into 1,400 members across the world, the potential of what you can do with that and stimulating a market in very unique ways is simply an opportunity not to be looked over. So it was a fairly simple move away from working as a trauma physician for almost a decade, and then into the technology space. And then we also do a lot of policy development work with the WHO. So a very unique mix of public health engagement, technology, and obviously the business side of mobile operators and healthcare.
So how does a trauma surgeon find his way into the policy space, and how does that feel?
Also by default, largely. Don't know if it's both a blessing or a curse, but really was looking at healthcare in general, and after working in the public sector for 9 years, I think became a little bit disillusioned by what we were seeing happening both at a local level and regionally in healthcare. Rising costs, reduced quality, and just an abysmal state of health access for many patients. So the altruistic motive behind it was to become involved in the macroeconomics of healthcare, and I think now bringing in the ubiquity of mobile and that mobile ecosystem into that public policy, we're going to look at very disruptive innovation and disruptive delivery of that innovation.
So GSMA, I was looking at the history. It's had just an exponential rise since its early meeting or first meeting in 1982. The metrics are astounding in the multiple billions. Talk a little bit about any of the programs that have been involved in the health space.
Sure, it's you're absolutely right. It's been a phenomenal exponential growth, and some of that has then been translated into healthcare in the form of regional engagements with some of the donor community, the Norwegian government, the British government, and UK Aid have been strong partners of our health program, and we now work.
Donor as in organ?
Donor as in development organizations.
Versus transplant donor organizations.
Exactly, exactly. Although sometimes it does feel like a heart transplant working in development space. So we've partnered with the development organizations, and really they bring the seed investment or the capital for us to stimulate partnerships across a number of countries, specifically in the areas of maternal and child health, which have the highest morbidity and mortality, and looking as though we won't reach the Millennium Development Goals. So very specific focus on accelerating the maternal and child health agenda, and then also very specifically with the UK Aid or Department for International Development in the UK, a partnership that focuses on nutrition across 10 countries in Africa and 4 countries in Asia.
So I finally learned what GSM stands for. It's the Group Société Mobile, and it's apparently the standard setting group that we know as the GSM networks.
Yeah, so that was in the early days of GSMA, GSM Association, which was born out of the first GSM standard in the late 70s. And as you rightly said, the first meeting that was convened in the early 80s then propelled the positioning of GSMA to expand into areas of both supply and demand of mobile. So we focus on areas like spectrum allocation, taxation, big public policy engagements, and then once we have that investment into the mobile infrastructure and the availability of mobile at the correct price points, we then say, how can we leverage that? And then GSMA also plays a very big role in areas, trying to bring ancillary areas like healthcare, education, the banking sector, media and entertainment, digital identity, digital inclusion, and others. So really a vast expansion of the remit of our work since the late 70s, and really just an indication of how rapidly this industry is evolving.
As a physician, do you see any reason this exponential growth could somehow slow?
We're already seeing the slowing of the growth in mobile. I think as a physician looking at M-Health, there are arguments that could be made that we're at the tipping point of a mini bubble, and many would say that it's not the technology that will revolutionize healthcare; it's the way in which we deliver that technology. So I think the critical next step for M-Health and the stakeholders within that are really how we partner effectively to create very sustainable and scalable business cases, not just in the US, but the huge opportunity that needs to be realized with WLSA members outside of the US market.
Are you actively involved on the use case side?
Yes, we are. So a lot of our work focuses on developing the proof points that we then advocate at various levels throughout government and health regulators and both providers, and the case is becoming stronger. I must say, from the early days in mHealth, looking at literature reviews and finding less than 1% of economic evidence for mHealth, we're now slowly starting to realize the benefit of that, or the critical need for that in integrating mobile into healthcare.
As a physician, are you excited by the applications of mHealth?
Absolutely. I mean, the stories that we hear from the patients using mHealth in any way, shape, or form is phenomenal in terms of personalized engagement, improved healthcare, and more importantly, in reduction of cost and lost economy to those patients.
And is there anything you can share on the Pan-African mHealth initiative?
Yeah, sure. So the strong interest in coming over here and discussing with your members was that through that Pan-African mHealth initiative, we've now established a partnership with the major mobile operators throughout Africa, which gives us essentially access to 70% of all mobile connections across Africa. So really the call to action is how we now leverage the technologies, the services, the partners onto that partnership, and realize the vast potential that everyone is so keen to speak about.
If I recall correctly, I think the mHealth Alliance has moved their corporate center of gravity to Africa. Is that correct?
So I think it's still on hold in terms of what that final decision is, but the mHealth Alliance has done fantastic work in catalyzing the market. They've been thought leaders in terms of bringing together society and very key decision makers from the early days of the mHealth Summit that was launched, I think it was in 2009 or 2010, and looking at the evolution of the market. The next step for them is then to understand what that strategy is. So looking forward to seeing that.